embarrassed to be talking about epidemiology among people who know a lot more about it than I do. But for those of us in my generation, so Alan Robin maybe, we all know about Sir Stuart Duke Elder. He was an incredible contributor to ophthalmic knowledge. And for those of you for whom his name doesn't automatically ring an alarm, he's the one who put together this remarkable system of ophthalmology, the world's biggest ophthalmology textbook. And in 1955, he said that glaucoma is a sick eye and a sick body. And I was asked to talk about this at one time because Dr. Sohan Hayray and I had done a study on nocturnal hypotension and normal tension glaucoma. And I think we all have had this experience. You're in the clinic and somebody comes in and they're only 57 years old and they're on like every medicine's ever been described. And you can think, well, yeah, I guess this is true. I guess glaucoma patients are pretty sick people. But then the same clinic, this 90-year-old lady walks in who is incredibly mentally sharp. She's healthy. She's on virtually no medicines and will probably live to be 105. And then you're thinking, well, maybe they're not so sick. So what's the data? Is glaucoma a sick eye and a sick body? And this is a vast topic, like the Grand Canyon, and it is a lot of controversy. There are a lot of studies that show exactly the opposite thing. Are they sicker? Are they likely to die younger? And we know that normal tension glaucoma clearly has some vascular risk factors. You know, we've been interested in nocturnal hypotension, sleep apnea, more likely to have had severe hypotensive crisis, Dr. Drance's study, more likely to have migraine and Raynaud's syndrome. There's more recent evidence about low cerebral spinal fluid pressure. But what about the usual high pressure primary open angle glaucoma patient that makes up a lot of our practices? There's papers describing associations with virtually everything, but I'm only going to talk about three: diabetes, dementia, and early death. I guess my feeling is if these people are a lot sicker than everybody else, they should die younger. And so we'll get to that. And basically one of the real problems in looking at any of these studies is glaucoma patients are plugged in to the healthcare system. And because of that, they're more likely to have their hypertension diagnosed, they're more likely to have their Alzheimer's disease diagnosed, and it makes all of the studies a little bit muddy. So what about diabetes? There's this giant insurance research database in Taiwan, and they looked at 3 controls for every open-angle glaucoma patient. They matched them for age, gender, whether or not they were urbanized, and monthly income. And they found that glaucoma was basically associated with everything. Everything except 27 of 31 things that they looked at as comorbidities, everything except metastatic cancer, tuberculosis, pulmonary circulatory disease, and paralysis. But they found glaucoma in 30% of diabetic patients versus 19.5% of controls for a relative risk of 1.78. But what about the other side? So this is the OATS data. I mean, I think OATS is a study, the ocular hypertension treatment study, that certainly in the US has influenced our care of patients more than any other study. And when they looked at things like nocturnal or low blood pressure, they found that that was a high relative risk of developing glaucoma that sort of fits with other studies. Central corneal thickness that Dr. Grover was talking about, again, relative risk of 1.71. When they looked at diabetes, relative risk was 0.37. So diabetes in this study was protective against developing glaucoma. There's been a lot of hand waving about these data, but the data are the data. So in this study, diabetes was not felt to be a risk factor. What about dementia? A study in the US looked at all death certificates in 1978, and they found glaucoma was 2.8 times more common in dementia patients. But they acknowledged that these patients are more likely to have been examined due to a chronic health condition. Alfredo Saduns did a study where he did a post-mortem exam of optic nerves of patients with Alzheimer's disease, found degeneration of retinal ganglion cells, especially M cells. And a really interesting study in Germany, they looked in 2 nursing homes, and they looked at all patients with Alzheimer's disease and Parkinson's disease, and the control group was everybody in the nursing home who didn't have one of those 2 diseases. And so this is looking at how many had glaucoma, Alzheimer on the left, Parkinson on the right. So 24% of these patients had glaucoma versus 6.5% in controls. And even more interesting to me was that if you look at how many of these Alzheimer and Parkinson patients had ocular hypertension, it was virtually 0 versus 7.5% in controls. The implication being that if these patients developed elevated pressure, they developed optic nerve head damage. Well, are they likely to die younger? Big study in the US, the Framingham Eye and Heart Study, found they compared people who had high pressures or glaucoma treatment with patients who had lower pressures. And they found those with higher pressures had a higher death ratio, but as they controlled for things like age and gender, hypertension, diabetes, BMI, and smoking, that all went away. And a large meta-analysis done in 2009 looked at 9 cohort studies with relative risk calculations for all causes of mortality. And overall, the relative risk in glaucoma patients was 1.13, and they felt that there was really no evidence of increased mortality in this study. In the studies that do talk about increased mortality, they say, well, maybe it's the medicines. And a study from Paul Lee's group, Josh Stein, did a study looking at a large managed care database of well over 1 million individuals. They looked at patients who were glaucoma suspects or had glaucoma over 40 years of age. And what they found was using any class of glaucoma medication was associated with a reduced risk of dying, 74% reduced risk of death. So I think all of these studies share a problem that glaucoma patients are people who are established in the healthcare system, and in any country that's not true of everyone. So what do I believe? And I'm not an expert in this field, but I really love this Malmo study because it gets rid of a lot of the problems that we have with all those other studies. So they went out and looked at 33,000 patients in the community. They targeted elderly patients because they're interested in glaucoma, and they found 402 new cases of glaucoma. So these are not people who came into the healthcare system because they had other diseases, they were seeing their internist and had a disc hemorrhage. These are people who are out at the shopping mall. And then they picked 804 controls matched for age and gender, and they followed them for a really long time. So I think, to me, the design of this study gets rid of so many of the flaws in the other studies. And the final result is at 10 years, these patients have no higher rate of mortality than anybody else. So Duke Elder, a pretty smart guy, thought it was a sick guy in a sick body, but I think, to me, the Malmo study is really compelling that in general, these are not sicker patients. But there's a lot of conflicting data. Thank you very much.